the meeting, Eugenia, so it's fine. Okay. As I started to say, a substantial part of the funding from EEC, although as a proportion of our total funding, less and less over the years as greater investments have come from state resources, from our governor and legislative support. But a substantial amount of our funding comes from the federal government in the form of the Child Care Development Fund or the Child Care Development Block Grant. And as a requirement, every 3 years, the agency must do what is called a state plan. So a CCDF state plan. I view this as largely an administrative task, but a very big and important one for the agency in terms of compliance with federal requirements and ensuring that we are meeting our obligations under federal regulations and rules and protecting every single dollar that we can get from the federal government to bring into the state. So as a result of that, we do something called a state plan every 3 years. And we are viewing this just as an opportunity for us to report to our federal partners the good work already underway. It is not a separate sort of strategic activity as much as an opportunity for us to, within their very bureaucratic template, report on the strategic work of the agency across various initiatives. So there is the Child Care Development Fund predominantly funds child care financial assistance, but really touches almost every part of the organization, whether it's licensing or background record checks or our quality work or supporting our some of our key initiatives. So it's important that we're able to report on all of those. So as part of the requirement for that state plan, we must have stakeholder engagement by our formal advisory committee, and that is all of you. And because we have two of them, we decided the best way to make best use of everyone's time is to fold this into a single meeting. Many of you serve on both committees, so today is probably a day you're grateful that we are folding it together, so you have one meeting instead of two. So this is an opportunity for us to formally engage with all of you around our state plan activities, the development of that. It's an important step in our process to engage with our stakeholders. So I will shortly be turning it over to Jocelyn and Tyrese, who will have an opportunity to walk through sort of what's required as part of that state plan, sort of how we're approaching it, and probably most importantly, end with kind of what the key strategic initiatives are that are underway at the agency. And so we beg your indulgence a little bit in some of the bureaucratic pieces of information that we'll need to share with you as part of this obligation. So grateful for that. And then have an opportunity certainly to discuss some of the strategic initiatives as we present that as part of the state plan activity. So let me start with just a couple quick updates for the agency. So many of you may have seen that last week we had an opportunity to testify in front of the Joint Legislative Committee on Ways and Means in support of the governor's FY25 budget. And many of you were also there, so thank you for being there and supporting what is really incredible proposed investments for the agency around the Gateway to Pre-K agenda. And I'm not going to go into great detail. There have been lots of other opportunities for us to discuss it. But I will say we have, over historic investments from last year. We're seeing a 3.4% increase this year in the governor's proposed budget, near over $1.5 billion in investments across the various parts of the agency, including continued funding for the Commonwealth Cares for Children program, new investments in access for childcare financial assistance, as well as continued support for our Commonwealth Preschool Partnership Initiative and a real focus on expanding access to high-quality preschool, starting in our gateway cities, but with a vision of making it low or no cost across the state for families everywhere. So we are pretty excited about the governor's budget, and we thank you for your support for the agency. And we look forward to keeping you updated as the process unfolds. We have a board meeting next week. We will be in Boston. We'll have an opportunity to dig into both C3 as well as our child care financial assistance programs, kind of an update on caseload trends and where we are. Many of you are aware of the very excellent news that we are now up to pre-pandemic levels of serving 58,000 families through childcare financial assistance. That was our goal for this fiscal year. And in partnership with our contracted providers and our childcare resource and referral agencies, we have reached that goal earlier than we anticipated. So very pleased to be able to hopefully anticipating spending every dollar it's been appropriated to serve kids and families who need help paying for childcare on those families. And hopefully we'll have opportunity to continue to expand access into fiscal 25 should we get support for the governor's proposal of an additional $75 million. So we will, many of you have heard either directly from one of us, probably Eugenia. So thank you, Eugenia, for your commitment to making sure we are communicating as much and as quickly and as efficiently as we possibly can about changes that are happening in the agency. We don't always have good news to report. Sometimes it's hard news, but our commitment is to make sure that we're reaching out and talking with each of you or communicating with our field generally. So we'll have a chance to pick up on this at the end of the meeting and discuss if you can sort of hold your questions on it till the end, although I know it's a top of mind, that for the last several months, the agency has been tracking what we anticipate to be a deficiency within our Commonwealth Cares for Children program. We are going to fully expend the $475 million that has been appropriated for this program. But due to good news, greater than expected growth, which means more kids, more programs, more staff, more capacity, that the program has grown at a faster rate than we anticipated. So we are in the position of having to make some late in the fiscal year program adjustments and payment adjustments for the May and June payments only in fiscal 24 to be able to live within our appropriation. As I mentioned, the governor's budget includes the full 475 for next fiscal year, and the agency is hard at work on changes both now, sooner than we had hoped in 24, but also thinking about 25, as we have with all of you, about how we make a transition for this program from COVID era stabilization into ongoing support. So we'll have an opportunity to talk a little bit at the end about the status of the program, the different levers for change that the agency has been considering, as well as our guiding principles that we used, both in terms of the program adjustments that we are implementing now to live within our budget, as well as thinking about changes going forward in 25 that can make the program more sustainable and predictable for EEC, for the Commonwealth, and for all of our providers and children and families that you serve. So I'm looking forward to that discussion. But with that, I'm going to turn it over to Tyrese and Jocelyn so that we can dive into our state plan. And then we'll do some on the alternative methodology and then turn to C3. Okay, thanks everyone.
Thanks, Commissioner. Afternoon, everyone. Can people see my slides?
We're seeing the presenter view, Therese. Beyond that, I can't help you because I've never been. There you go. I need to know how you did that.
If you have two screens, you just need to swap the screen it's showing.
What about now?
Nope. Go up to display settings and swap.
I had it a second ago.
Yeah.
Oh, I see. You just went out of presenter. Yeah.
There you go.
See it now? Thanks. Yeah, yep. I do have two screens. Whoever was helping me. Thanks, Sarah. Afternoon, everyone. I hope all is well. Happy New Year. For some of you, I haven't seen you. Happy New Year. As the commissioner opened, she shared that we're going to be talking to you today about the CCDF state plan. I hope we'll make it. We hope it won't be too boring as we go through it. But I want to start by saying the CCDF plan. It gives us an opportunity to talk about all the great things that we're actually doing, right? And that looks like, and it looks like what we're doing across the agency in many different areas. It's really the who, what, and why we do the work that we do here at EEC. And so Jocelyn and I are gonna do a quick background and some overview, and then we'll get into our strategic objectives. And then we'll get into some of our key projects that fall within our overall agency objectives, which go across 4 areas, which are family access, program quality, workforce supports, and I'm forgetting the other one. Oh, program stability. Can't forget program stability. So what is CCDF, right? CCDF is the Child Care Development Fund. It's a federal and state partnership that is authorized under CCDBG, right? What that is, it's our Child Care Development Block Grant Act, and it provides funding from federal government in partnership with the states. Those funds fund, as the commissioner stated earlier, 50%, just under 50% of our budget. It defines how states, and they refer to states or our agencies as lead agencies. It defines how we are in alignment with the CCDF federal rule. And that rule really determines the way that we administer child care financial assistance and other programs and support. So our standards, consumer education, as well as qualifications for our workforce. So we're currently in our 3-year current plan cycle, which will end in September of 2024. Our new plan will start October 1st. So we submitted, what we'll do is we'll submit the new plan in July, and it will be approved for an effective date of October of 2024 through September 2027. This is an administrative requirement that all states have that receive CCDF funding. And the goal throughout the plan development is to work collaboratively and engage with our stakeholders. And so this is one of our engagements. And what we intend to do through this engagement is show you how it all connects. The primary focus of the plan will be around progress, right? What's the progress? How are we implementing our policies and our procedures, as well as how do we report in transparency what we do. So our scope is to, and I'm going to slow down a little bit. What our current scope is really to develop the plan. So we're currently in the draft process, and we're drafting the plan across these 10 areas. So the Federal Office of Child Care, it requires us to meet requirements in these 10 areas. So from CCDF program administration through to child care affordability, which includes things like equal access rates, through qualified, and through our workforce supports, through to program integrity and accountability. So what we're working through is how do we meet all these 10 areas within our current work? And we do that in 4 different ways. Our time, which we'll get into later, our timeline started in January. We came together, put together a team. So we have a pretty big team that is working on drafting the plan. We begin by looking at our current state plan and what changes were going to be made there. And then we looked at what were the changes that the new CCDF pre-plan will have. So the way that we put our information is through the preprint, and the preprint has these 10 key areas. We notified our board at our February board meeting, and then we're doing our stakeholder engagement over March and April, and maybe pieces of May. We're engaging with these 2 advisories, as well as some of our local government and our tribal counties as required by the Office of Child Care. Our hope is to bring a draft plan out for public comment at the end of April, early May, and to have a final draft to present to the board for a vote in June, and to submit it in July for approval. And so what is the purpose of CCDF? So the purpose of CCDF is compliance. I like to start with compliance, transparency, and planning. And we talk in the way I've learned this, as you know, I've been here a little over a year. The way that I've learned it was that the why is the compliance is our why, right? It's how we tell the Office of Child Care how we implement our key policies that are in alignment with the CCDF rule and the CCDF policies and procedures. Like, how do we implement childcare financial assistance? How do we implement licensing? How do we implement workforce supports? How do we implement quality measures for our educators in our programs? And then the what is transparency. How do we show through our data how all of our work looks in work? How do we show through our key data those policies and practices and work, right? And that's the transparency. Part of the plan is producing key data around our programs, our providers, the numbers of families that we serve, and the childcare financial assistance that we provide to families. And the how is how we engage to build our policies to truly address the needs of the communities, our partners, you as our providers. And how do we do that in a way that supports our workforce as well as our other partners? And how does this support the overall goals of the agency? So how we intend on doing that and how we're currently doing that is through our 4 strategic agency objectives. And those objectives are family access, program quality, program stability, workforce supports. And the last one is our agency infrastructure, which is key because it's all of us who are here who are who are performing the work. And so family access is how do we ensure that our families have equitable and quality access to affordable early education and care. Our program quality is directly connected to our licensed and funded programs for our children, ensuring health and safety. That's our licensing, right? Is our programming culturally responsive and inclusive? And does it really support learning for our earliest learners? And then our program stability, our programs licensed and funded by EEC and operationally stable. Are they stable and financially sustainable? And then our workforce supports is, do we have a diverse field of educators, right? Do we have leaders and program staff that are competitively compensated and that are in their professional development is supported and promotes quality? Jocelyn, do you want to add anything here?
No, I think you covered it at a high level, and then we'll sort of circle back and dig into the specifics of all of this. But just, sort of calling out, really, the exercise in writing the state plan has been to take the work that we're doing and communicate it in the structure that is required for us to communicate to the OCC around how we're actually implementing all these things and meeting the expectations that they have, but the work that we're talking about is the work that we've been doing for a very long time and that we've been talking about with you and with the board as we've been doing it. So I think just sort of calling out that piece, and then we'll sort of provide a little bit of a description about how we're mapping across these things.
Yeah, absolutely. And I want to share too, as you said that, Jocelyn, I thought about the current work that we are doing. We are reporting a lot of our new work now. The CCDF plan gives us an opportunity to package it all together, right? To package it all together and present it to them. I see a hand before we move to our next slide. Hi, Patrick.
Hi, just a quick question on the timeline. What is the time frame for public input? I'm assuming it's between that release and the finalization. I just wasn't sure if you had
Yeah, so if we go back to the timeline, the public comment period, we're anticipating we're anticipating releasing it for public comment at the end of April. So you'll have 30 days to submit your public comment, and we'll also have a forum.
Okay, thank you.
A public hearing. And so we'll jump right in. Jocelyn, I'll kick it off. I'll talk about family access, and then I'm going to turn it over to Jocelyn and talk about family stability. So our family access objective directly connects to four of the 4 out of the 10 CCDF areas, right? It looks at all things really childcare financial assistance as it relates to eligibility, enrollment, and continuity of care. That's inclusive too of how we navigate children through the system as they transition. It looks at affordability, parent choice, equal access rates, and also family outreach and community consumer education. So that's like our family and community supports, our coordinated family and community education grantees. It's inclusive of that, and to highlight what we'll be doing in the state plan as it relates to family access. As you probably already know, we're going to be putting in all of our childcare financial assistance reforms, and it's to ensure that all of our policies and procedures are fully updated and finalized so that we can put them in our plan and we can move to fully operationalizing them to ensure that there's alignment in when we talked about the purpose in the compliance part. We're required by Office of Child Care to ensure we're meeting certain requirements as it connects to the rule, and we'll be doing that. We'll be highlighting all the CCFA changes, which would include a policy change we made to our early education staff pilot, that we'll be moving it from a pilot. Currently, it's in our current plan as a pilot. We'll be moving it to an official priority access point moving forward for our early education and staff. Jocelyn?
Thanks. So in thinking about program stability, and if you look at these plan sections, you can see a lot of the focus is on, sort of some of the nuts and bolts work of managing the subsidy system. So making sure that programs are supporting us in providing parental choice, in implementing the subsidy system appropriately, particularly through our contracted providers who do play a pretty significant role. But there also have been opportunities within the state plan to talk about some of the work that we're doing more broadly to support stability across the system, particularly, and we'll talk more about C3 later today, but there has been an opportunity to highlight the importance of C3 in stabilizing programs, supporting them in some of the higher cost endeavors, such as supporting infants and toddlers, and generally building our system. One of the set of questions that we did get were on how are we monitoring and understanding the system of providers that we have available to families and engaged in our subsidy system, which was a great chance to talk about some of the work that we've been doing to build out our data systems and our ability to monitor holistically, but also thinking about the ways in which we can use specific mechanisms such as C3 and the contracts to build that system and to ensure that system is operationally stable and financially sustainable. And I think on that last point, obviously, the rate increases that we've just put in place are also a very important part of that. They're really significant, very significant for programs and for programs' finances, and something else that we feel is very important to call out. Go to the next slide. So in thinking about program quality, it is obviously very important that the programs that we're providing children access to are high quality. And there are a number of questions throughout the state plan that provide us with an opportunity to highlight some of the things that we've been doing, both on the front of supporting the workforce, who are really the sort of foundational layer of quality, because what happens in the classroom between educators and children is really the heart of program quality and the ways in which children gain the greatest benefits from participating in an early education and care program, but also thinking about the ways in which we are understanding quality systemically and using the funds to support investments in program quality. So we use these sections provided us with an opportunity to talk a fair amount about the professional learning system that we're building across the professional development systems in the academy, which is sort of provides statewide and broad-based supports, but also the more targeted supports provided by things like the early childhood mental health grantees, and also talk about the ways in which we're investing in an ongoing focus on continuous quality improvement as a primary mechanism for program level quality improvement. So we've sort of thought a lot about how are we understanding the quality in our system and the ways in which we're investing in supports for programs and using CQI as an effective tool for ongoing quality improvement. On the workforce side, there's a lot of interest, obviously, in both the nuts and bolts of our expectation of our workforce and also our ongoing long-term plans for working with the workforce, which is nice because we are certainly in a transitional period at EEC where we currently have in effect certification requirements and the alternative minimum hiring requirements, but we're looking ahead to the development of a credential and in the context of a broader focus on professional pathways for educators and other staff in the early education and care field. So this provided an opportunity to talk about both the current state, like just the concrete requirements that currently exist, but also the ways in which we are creating a map of potential professional pathways with the idea that the credential will, sort of support us in understanding what the expectations are across the full range of opportunities that are available to those in the field. And also, interestingly, some questions about the extent to which we're thinking about providing recommendations on a salary scale. So that is certainly something we're keeping an eye on as we map out the professional pathways and do have a plan. And also thinking about that in the context of the cost work, and do have plans to start, continue the work that's already started around thinking about what expected salaries could potentially be. But it was just interesting to me that there was such interest on the federal side in that as well. Let me go to the next slide. I think, Teresa, you and I are sharing this. I might send it back to you for the first one and we can go back and forth.
Sure. So this slide is providing you a more detailed list of what we see as our actual key, I like to say our key projects within our overall strategic objectives. And of course, as you see, childcare financial assistance is at the top, and we're all of our regulatory and our policy reform implementation. We've been asked multiple questions around this within the state plan, down to how are we doing it? How do we define priority populations outside of our DTA, our families that are working with the Department of Children and Families and working with our TANF agency? They want to look at how are we looking, are we increasing our rates? They require us to review our rates and to do a market rate survey, and they given us this option to apply for the alternative methodology. And we took that opportunity, and that will be a part of our process too. And then our early education staff access. Whenever I say this now, Jocelyn, I feel like it belongs in two places, right? It is family access, but it's also workforce supports. And what's different in this CCDF plan cycle is they've asked us not to repeat all four core areas of our programs. And so it's hard. And when we are talking, when I have to talk about the early education staff pilot on ways that we support our workforce, right? They want to know about innovation, right? They want to know that we're expanding access, not just for families, but we're looking at how do we create a sustainable workforce. And so this is an area where I'm talking about it in one way for access for families, because the educators are also families. And then on the other side of the state plan, we're talking about how it supports the workforce.
Yeah, and I think just calling out on that, what the slide really highlights is the ways in which some of the important initiatives that we're working on cross multiple goals for the agency. I'm not sure if you're probably all processing the slide, but we have those little icons for each of the different areas of focus that we've been talking about, and the ways in which each of these sort of concrete projects here cross over those. And I think it really gives a good sense of the breadth of the work that we're doing at the agency and the ways in which individual projects are all designed to serve multiple purposes and to really work together to support the long-term goals of the agency. One thing that has been, called out explicitly by the governor and the secretary is one of their priorities for FY25 is this goal of expanding access to high quality preschool. And I think in just highlighting from EEC's perspective, this really is about thinking about high quality preschool across the mixed delivery system. And sorry, I'm getting distracted by the chat. I'm going to talk and then I'll come back to the chat. I know there's some questions in there. I'm not ignoring them. The Commonwealth Preschool Partnership Initiative, CPPI, is a primary mechanism by which we are able to bring together districts and local EEC license programs to work around a focused effort to expand access to high quality preschool, both thinking about where there are barriers to access, particularly around cost, and address those, but also looking at mechanisms to support aligned quality through curriculum selection, ongoing professional learning, particularly joint professional learning across all educators in the field, district and private program alike, and thinking about the ways in which there's access to special education broadly across the system. So one thing that we've really been pleased that there's been a lot of enthusiasm and focus on is thinking about ways in which this funding can support districts in providing itinerant special education services in classrooms in private licensed EEC programs, which really changes, I think, the nature of access to those services for working families, and reduces the number of transitions that children might have to face who are trying to access those services. Another priority for the Secretary and the Governor is the supports for early literacy, and literacy launch has been announced. EEC and DESE are working very closely together on that initiative, and looking at ways, again, to take that basic framework that what is happening in the preschool space is happening across the mixed delivery system. And we need to think about the full mixed delivery system as we think about the types of supports and expectations that are provided to educators, to programs in better supporting children in their literacy and language development. So that is something that is very much under development right now, but an ongoing and very active world of collaboration between EEC and DESE and the Secretariat. On the workforce development side, I think, and this is where I can get back to some of these questions. So the development of an educator credential is really, I think, the framework on which the next stage of work for the workforce will be hung. This is where we are defining the levels of expertise that we might expect across the system, the types of competencies and the skills that we would expect to see at different levels. So it doesn't just set a set of minimum expectations for different roles, but really a roadmap for the ongoing professional learning for educators, as well as a roadmap for the types of roles that you could have. And one thing that we've been thinking very much about is, for the experienced educator, where do you go? What do you do? I think traditionally you either stay in the classroom or you become a director, but that's not necessarily what everybody wants. So we're really starting to look into the ways in which the system can expand out opportunities to be a mentor teacher, to move into a coaching role, to use that skill set, but not move so far away from the classroom necessarily, and making sure that the credential that we're developing is supportive of a broad range of roles, particularly at those higher levels of skill sets. As part of that process, and this is the connection back to compensation, we are mapping professional pathways. I think it's just important to recognize that any map is not going to get everything that is possibly out there, but it does provide a sort of core roadmap for the types of opportunities. And as part of that mapping, we do have the opportunity to think about where salary recommendations that, both could provide a set of expectations for the field, but also something that we can look at ourselves when we do our own continued cost work, then it can inform the funding that we provide. So things like C3 and subsidy rates. That, I think, is the primary mechanism that we have to start working on those things, since we don't pay educators directly ourselves. But what we do is we set up the system that is robust enough and has clarity enough around the expectations around salaries to pay educators. The other piece that's really important for the workforce development is in support of all of the changes that we're talking about. We need to make sure that the partnerships with higher education are both strong and aligned. So we're really working on multiple ways to provide educators access to higher education, thinking about all the different areas of the different funding sources that are available, from the DHE scholarship, the funding available through career pathways, and then some of the new initiatives coming out from the governor and the Department of Higher Education, but making sure that those are really well aligned, that they're accessible to educators, and that institutions of higher education are also pragmatic and strategic about how they blend and braid all those different funding sources to really support access. We're also looking at the ways in which educators experienced in the field can have currency in a higher education space. So, sort of both thinking about where is there space for credit for prior learning? What does that look like? And how could it be more consistent across the community colleges? That's something happening with support from the Massachusetts Association of Community Colleges, as well as looking and thinking about the ways in which the overall coursework and sequences of courses that are available through the community colleges is aligned across the system to the extent possible, as well as with where we're going in the credential. So we're working very actively with our Career Pathways partners to both share our thinking and get feedback, and also engage in this sort of design work with them. And finally, the other really important thing for us to think about on the workforce side is this issue of the pipeline in. Like, we've heard loud and clear that this is one of the biggest challenges that we're facing right now. And apprenticeship programs have really emerged as a very powerful tool to support not just entry into the field, but in a supportive way where one is coming into the field, but also learning on the job, and also potentially supporting advancement through the field. And there are so many programs and opportunities that are supported through the Executive Office of Labor and Workforce Development. We've really begun to develop a collaboration with that agency to think very intentionally and carefully, and following the lead of others who have been out in the field doing this work in advance of us, to think about ways to really effectively leverage those opportunities, and also make sure the expectations and the opportunities are aligned with where we're going and make sense to the field. While simultaneously building around those opportunities the types of supports that are really particular to our field, such as one thing that we're hearing is support in training and support for mentor teachers. That's a new role, sort of. I mean, I think every teacher has been a mentor for those working in their classrooms, as an example, but in a really formal, structured way as part of an apprenticeship program. It is a new role. It's a different set of skills, and that's something that we've heard training would be really, really helpful, as well as some support in coordinating and building out structured systems and thinking about where the entry points are to these types of apprenticeships. Sorry, just looking at the chat quickly to make sure I'm not missing anything. I'll talk about quality next.
Do we want to pause? Do you have that? I can't see the chat, Jocelyn. So do you feel like we need to pause?
Happy to pause. Maybe actually I'll talk about quality and then I'll pause.
Okay.
And sort of, because these things are also interconnected. So the final area that I've been focused on is this issue around how do we support program quality and stability. And we see these two things as really tightly intertwined, though there's a financial and an operational side on the program stability, and an educational leadership and practice side that's really much more of the program quality pieces, but those things work together. And one thing that we have been very intentional in calling out in the domains of quality that we've discussed, that business practices are actually an important part of a program's quality. A program that has strong business practices will use resources better, support educators better, and generally just is a more stable and more highly functioning program. But we also recognize programs do need effective financing. Commonwealth Cares for Children, C3, is obviously something that has been out there for a while, and we recognize is an important financial input for program. The rate increases as well have been important for programs. So that provides a layer of foundational support on the financing side. And then on top of it, what we want to build in are resources to support facilities improvements. We have the longstanding EOS grants, but have also this year gotten funding to provide grants that are similar, focused on capital improvements, but for programs that do not meet the not-for-profit status requirement of the EOS grant. So programs that might have a more for-profit focus, but we can let those in, as well as working currently on designing a program that's focused on providing access to these resources to family child care educators who have not historically had an opportunity to use these funds. So that's something that is really a very important foundational and stability component of this, but also connects to quality, because the quality of the program site is a really important part of the program's overall quality, both in terms of the program's ability to meet our very high licensing standards, as well as to support ongoing learning in meaningful ways for educators. And finally, on the CQI front, I know there's a question here on that one too, so I also just want to look back into what that question. On the CQI front, what we're thinking about is that it's a process and support focus first. So really the core process by which we've seen really effective ongoing program quality improvement is through this process of continuous quality improvement, where there is a cycle of reflection for programs, identify data points to understand what's happening in a program, and then reflect on the data points and think about where are the areas for improvement that they might focus, and then identify a plan for how one moves forward and what are the next steps that need to be taken to address wherever the gaps or the opportunities for improvement or growth have been identified. Our expectation is typically much of that action planning is around the professional learning of the staff and the support of implementing new practices in the classroom. So it's sort of both accessing training, but also supporting the ongoing implementation, practice, and development of the skills on the ground, and the ways in which educators work together to support each other in that type of process. So we see a continuous quality improvement plan becoming the touchstone of all this work. That's the place where the program identifies their goals and the ways in which they plan to meet their goals. And then we are building a system of support around that. So the program quality specialists play a really critical role in being a primary point of contact for programs and understanding how to think about this planning process, but also then identifying where there are resources that are available. And the system that we're building out and have in place and are continuing to build out to support programs in ongoing improvement, in accessing training and building staff skills include the professional development centers, the statewide academy, the early childhood mental health grantees, the community colleges. There's a whole range of opportunities that programs can take advantage of in thinking about how to access training and ongoing professional learning to meet goals. And we want to be part of helping programs find the resources that they want. There are also many other resources out there that programs might choose outside of our system, but it is really making sure that everybody's aligned and focused around the programmatic goals, and that those goals are heading in a direction that builds quality for a program. So I think, to the question about there particular areas of the QRIS that you want to keep or move away from, I think that the piece that was challenging with the QRIS is it was both a quality improvement and an accountability system, and that creates a lot of attention for meaningful engagement and continuous quality improvement. What we want to focus on is the quality improvement side, but at the same time recognize that the data requirements that were built into the QRIS were really very important, that those points of data, standardized assessments, those all play a very important role in understanding what's happening on the ground that then can feed into the ongoing continuous quality improvement. So we don't want to lose that piece as well. All right. I am going to pause now to see if anybody wants to ask questions, and you're certainly welcome.
Why don't we just finish this slide and then we'll stop sharing for a minute. We can address some of the questions and thoughts in the chat, and then we can do the alternative methodology, because this is really what we were hoping to get, right? The sort of stakeholder engagement around the key initiatives, much more than we were like, here's the state plan structure. So it's very helpful to get the feedback in the chat. So I'll hit the last two, and then we'll stop sharing and have a chance to kind of have a little bit more feedback and discussion. We can hit some topics in the chat, and then if other folks have things. So clearly the foundation on which all the rest of this work stands is the health and safety work. It's obviously the agency's top priority to ensure the health and safety of children in our childcare programs, as well as our residential and licensing programs. We are in regulatory revision processes for both residential and for childcare licensing. Our residential licensing is a little bit further ahead than the childcare one, and the childcare one's probably going to take at least the next year, a year and a half, for us to really meaningfully engage with our stakeholders, make sure we're understanding the impact of changes, researching on best practices. The residential regulatory work's been underway a little bit longer, and I know some of our stakeholders have been engaged in that, and we look forward to deeper engagement around those, really bringing families at the center of both of those sets of work, as well as making sure we're supporting our programs and providers. And as many of you know, and we've reported on here before, it's been ongoing, but really meaningfully since 2022, we've been in a major reform and modernization of our background record check system, which is the front door both for our workforce as well as for our licensing. We've been modernizing that system, retiring paper-based and outdated systems, and bringing greater technology for individual educators as well as for programs and in the review process for EEC. And that work continues, including making sure that we're in compliance with some very important federal requirements around out-of-state checks. So we look forward to keeping you all updated on that work as it proceeds as well. Again, the foundation and sort of the front end of many of our important systems. Connected to that is our overall IT system development and modernization. I had an opportunity to testify in front of the Joint Capital Assets and Bond Committee in support of the Governor's Future Tech Act, which includes proposed $12 million to upgrade our childcare financial assistance systems. And we've been also working on an overall blueprint around upgrading our technology systems, which are in some ways siloed and in some cases out of date. So we really need to be refocusing on our sort of user and human-centered design as we build our technology systems to facilitate more modern access and dignified access for families at times and locations and places that make the most sense for them and languages that work for them. But we also think about our programs, our educators, and EEC staff, as well as our partners as key users in the system, and wanting to make sure that our systems are modern and facilitate that work to make all of our workforce development and our family access systems as easy to use as possible. So that work is ongoing as well. And kind of wrapped all around this, you know, anytime you outline kind of your individual projects, one of the things you miss is sort of the taking a step back on the macro side. And I think one of the things we'd like you to take away from this slide is to know that we're like pushing every lever out here to try and figure out how to build the system. And that means not just pushing any individual lever, so more access for families, but making sure that we're increasing access at the same time that we're increasing rates and making it easier to do business and providing greater financial stability and health for the sector in general, while we're trying to make economic mobility for our workforce and wages also a piece of the system. So holding all of these levers together is a really important part of the system. So I'll stop there and we can pick up on some of the questions in the chat. And I'm going to take a couple of them to kick off, if you don't mind. So great. So I want to talk a little bit about infants and toddlers for a minute, because we're trying to build a system for everyone. And I know that we've called out universal access to pre-K as a high priority. But I also want to focus on the fact that we're doing that through a system and an initiative, the Commonwealth Preschool Partnership Initiative. We focused on this at our last board meeting. And the commitment of this administration and of this agency is to build that access through our mixed delivery system. And so the way the CPPI program works is partnerships with our districts. And a core part of making sure that we're using our mixed delivery system, which is diverse and is reflecting the needs and choices of families, is to make sure that we don't disrupt the market for infants and toddlers. So by building within the existing mixed system of programs that serve not just preschoolers, but also infants and toddlers, as well as our out of school time and school age programs, it is our intention to lift the whole system and make investments in teachers across the system. And we do that not just through CPPI, but for those of you who paid attention to what we were doing through our rate reform proposal, you know, we paid particular attention to infants and toddler rates and disproportionate increases in those rates to make sure that we were addressing what has been a system-wide challenge there. We have a reprocurement coming up, which I will not talk about in much detail, but that is another opportunity for reprocuring our childcare financial assistance contracts to try and support infant toddler capacity across the system and support programs who are serving infants and toddlers. C3 obviously is supporting our programs across the age spectrum and getting financial assistance and stability, operational supports to programs that are serving, school age as well as infants and toddlers and preschoolers. So the whole system is on our mind as we think about each of the different pieces and levers that we have. And compensation is a part of that too. I know that was the last question. The best way for us to be able to address increases in compensation are to make sure that we're continuing C3, which we know, and you'll see here and you'll see next week's board meeting, has had a significant impact on salaries. They're still too low, but they're heading in the right direction. We know the rate increases are also opportunities for programs to get funding right into the hands of our staff and to recruit and retain new staff and raise salaries. So wages and compensation and recruiting a talented workforce and making it a meaningful career pathway that people can choose and stay in is really the core of many of the initiatives that are here, whether it's apprenticeship programs or getting additional funding into programs as well. Okay. I know there are other questions in here, so we're happy to take them from the chat, or if you want to come off and annotate your question, we can take them verbally as well.
Commissioner, there's one in the chat on CPPI I just wanted to address around sort of monitoring the balance of funded classrooms between districts and community-based providers. And I will say that is something that we're paying attention to. There's currently a grant requirement that districts work with at least 2 EEC license programs or funded programs. And we do pay close attention as we work with the communities around the extent to which they are working within the district as well as with our providers. So that is one thing I think that's just important to call out. And I see, Eve, your question about, sort of like shortcomings, challenges. I will just say from my perspective, the biggest challenge I feel right now is I can see in my mind how all these pieces fit together in the future, and keeping them moving in line with each other and moving fast is honestly my biggest challenge right now. I feel like we need to do all of this tomorrow, but we can't. We have to make sure we do it right too. So
yeah, we have a pretty exhausted and amazing EEC team. But the question you're asking, Patty, is a question we're asking ourselves. What can we pause on so that we can make sure we're focused on the right things too? So I think we want to do it all. But it's really important that we sequence things so that we have the capacity to do it right. Okay, Roy, go ahead.
Hi, this is Roy Belson, representing the Superintendent's Association of Massachusetts. As most of you know, very aggressive collective bargaining has upped salaries for paraprofessionals and other staff members in the public schools. There's benefits, there's all kinds of things that people get. So the incentive to go work for us in the public schools is a lot greater, pensions and other things to consider when you have a mixed delivery system out there. So one of the things that I keep thinking about, since money is always going to be an issue, is what can the state do or propose with regard to tax credits for people who enter the field, or benefits and along those lines. Obviously free and low cost PD, which is always important. Subsidizing benefits, because most people in the public schools get healthcare and other things of that type, and some of the mixed delivery system can't afford it at that level. What can be done at that level? And you also have things like retirement benefits that people see in the public sector that is not available as easily in the mixed delivery system. Those things are incentives to keep people in place. And how would you pay for it? Well, if you can close the preparation gap significantly, you can reduce the number of kids in special education. You can improve language development through ELL youngsters, and you can do other things for family development. I think there's a pathway there to deal with compensation and workforce development, which needs to be explored and not just limited to trying to raise salaries, because that's always going to be a losing proposition when you have heavy program development, collective bargaining issues in the public sector. So just some thoughts, and like to get some reactions to that.
Yeah, thanks, Roy. I think, we've been thinking about compensation, obviously writ large, and, childcare access, healthcare, more flexible hours, vacation time. There are going to be ways we're never going to be able to compete probably with the public schools, but we are trying to make meaningful pathways, the true apprenticeship programs, and increases in educational attainment tied to compensation. So, it's a slow path, and like I said, I think there's gonna be things that are gonna make it hard for us to ever really be able to compete, but we have our educators at the heart of kind of every one of our initiatives. And I'm sure many of our programs and providers who are on would be talking about the challenges they're facing in recruiting and retaining staff. But the additional resources, the lifting of the field that I think we've been trying to do in general, both through funding, but also in valuing and recognizing the importance of early education. All of those are parts of kind of the way we're trying to make sure that this field is recognized and compensated for the work they're doing. Thanks, Roy. Appreciate your
Thank you.
comments. Helen?
Hi, Amy. I'm Helen Cherlevsky, Mass Association of School Committees representative and Brookline School Committee. So I put it in the chat, but I sort of want to amplify it a little bit. My concern is about low-income families in districts and communities that have no access to any voucher, any daycares or preschools that will accept vouchers. And what in this plan can help those families? Because there are a significant number within every community, and yet it's like there's no place for them to go unless the school district, provides scholarships, for everybody, and that becomes very costly. So I'm wondering if the plan might be able to think about that aspect in some way.
Yeah, I mean, I think part of what we're trying to do is incentivize participation in the child care financial assistance system for programs that may not participate. Raising rates, fixing our technology system, making it easier to do business with the agency, C3 grants. And we'll talk a little bit about how that structure may also be able to incentivize participation in child care financial assistance. So, we recognize that it's been challenging for programs to want to participate, but we are seeing a change in that. And we are seeing greater interest. I think Kim Dion, I saw they host orientations for new providers interested in participating in child care financial assistance. And you had to cap a couple of them, Kim?
Yeah, we offer them every other week. And, a year ago, we would be really excited if we had 3 or 4 people every session. And the last 2 sessions, we had to cap at 30. And we even at that had more than 30 show up. And we've signed on more providers in the last month than we had probably all of last year. There's definitely more interest because of all the things the commissioner just mentioned in folks participating. So we're helping to kind of bridge that gap.
That's
We've also seen an increase as we've rolled out the staff pilot that was supported by the legislature and implemented last year, which allows child care financial assistance at a higher income level for staff working in early education and care programs. So more programs who are interested in signing voucher agreements so that their staff can participate. So again, slow roll, but we're pushing each of the different levers so that, increasing and expanding access for low-income families, regardless of the communities in which they live and work. Okay, thanks, Helen.
Thank you.
Jessica?
Commissioner, how are you?
Good, how are you?
I
Nice
was
to
gonna
see you.
say that I liked your haircut when I saw you last, but I didn't get a chance to check in. But hi friends, my name is Jessica Juice Acevedo. I am a owner of a family child care program, and I'm a part of the EEC Workforce Council. So I don't necessarily directly have a question, but more feedback in regards to the presentation that we were presented right now. So I guess this is kind of a question to kind of start, but in regards to slide number 7, I believe it was, I'm just wondering in regards to organization, are these like how things are prioritized from family access to program stability, things of that sort? I know we talked a little bit about how they're all mixed up. But as somebody who is a part of the EEC workforce, I would love for us to actually start with the workforce supports at number one. I understand family access is obviously all of our priority and where vouchers and funding are coming from, but if we're not actually always starting at what the problem is the instability of the workforce, I think it's really hard to even address the issues. I also, as a part of the Workforce Council, would request that documents of this nature are sent along with the invitation for the Zooms. It's really hard to track or ask questions in real time or engage in this high level conversation if we don't actually have the materials. And we also need to make sure that we are following public laws of providing individuals within the meetings all of the information up front. I also didn't hear enough about family child care programs or program closures in regards to response or things of that sort, but I did hear how we have made so much progress with C3 and have opened and have made sure that our programs have stayed open. Obviously, there's changes coming up that you guys have been very clear were going to happen and have been advocating since the rollout of, if we don't continue to get this funding, this is what's going to happen. And I've heard it. So to get to this point and hear it actually happening doesn't surprise me. It doesn't make me upset. It doesn't make me angry because I feel as though as leaders in this profession, we have been moving the needle. We have been advocating at high levels that we have never had ever. And yeah, I think we do need to stop and, applaud all of the work that the commissioner and her amazing staff have done and the work that each of us do. But I also think that there's opportunities and gaps that we're not talking about. We continue to only prioritize vouchers when they are the small percentage and not really uplift the private family childcare programs that are little to never represented or spoken about unless I or somebody who's regularly in the space are there, which is, it's not appropriate for the workforce to continue to keep running and not be a part of the high level conversations that directly impact them. So when C3 stops or impacts, that doesn't impact you guys' pay. That impacts my program. That impacts me being able to continue my program for not just 5 more years, but 10 or 20. And that's the mentality that we should have when we're creating these strategies and these plans. So I would just ask and advocate over and over again that we are taking in consideration what are private programs doing, what is working, what do they need in real time, how are we moving this money forward to make sure that we're not closing programs, how are we making sure that we're not allowing for teachers to leave our spaces to go work at Starbucks. And I love Starbucks, but it doesn't, and that's a terrible example, but I'm sure we're all spending $7 to $8 and not thinking about it twice. But then when we're thinking about teachers and professionals, it becomes a whole conversation. And I think it's inappropriate for us to continue to have low-level conversations about compensation or healthcare when individuals of yourself and generations before us have been advocating for this work. At this point in the workforce, there only needs to be progress and strategy that actually aligns with what the request of the private workforce, which is the majority of the workforce, is. Jocelyn mentioned very briefly in her that, historically, family child care providers have not been provided grants or funding, but that also is in regards to certain, what have I experienced in regards to, so we've been left out because we operate in residential spaces. So things of that nature of well, if you're requiring us to operate in these spaces, then you should also allow us to get the resources within the district or within the department or whatever it makes sense. I just want to be open and honest. We had 2 parents get laid off, which is completely throwing off everything. And it was within 2 weeks. And there's no way that any C3 money or I can make up for thousands of dollars to make up for rent and payroll. So I'm not even talking about healthcare. I'm talking about keeping the business opening and running. And I'm at these spaces, I'm working, I do real estate, I'm doing everything, and it's still not enough. So I'm not talking about C3 not being enough. I'm talking about us taking this energy of what are we doing next and really moving that forward. and really actually saying that in the most professional, respectful, and happy. Because when we have kids, when we're engaging with our parents, they're happy. They're so proud of the work we do. Like, there's nothing better than I do than sit on the floor with my kids. But I can't do that because I have to advocate to make sure my program stays open. So for me, one of the solutions I do see, because I just came from UMass Boston, which I'm teaching at, I had an advisor for undergraduate. I have 23 students. Only 3 of them are on a licensure track. That is a problem. Like, they should leave school with their MTELs completed and ready to be a part of the workforce, but also be a part of the workforce before they even finish and get that experience. And we should optimize on the teachers and the professionals that see the value in the work that we do. And rather than continuously saying that we're underpaid, like, highlight the high level things that we do and the high level work that we do. I just went to the report release and it was talking about, you know, the aging field and things of that sort. So I'm turning 32 this month. If I was not in this field, I would never come in here. All we talk about is how we're not paid enough. It's high burnout, things of that sort. Like, people my age can make thousands of dollars at home at their, like, in their robes. Like, so for us to really appeal to the workforce, we really have to see what's working for the workforce currently. And those individuals are aging women that need healthcare. They're not men, they're women, they're our grandmas, they're the aunties of the community. So for me, I think that this is great, and I am so happy to continue to support the commissioner and EEC in the department to really strategize how to be more inclusive, to include private family childcare programs, but not just include them, open more programs. So I would love for us to, you know, add more family childcare programs in the slides or things of that sort, or just actually recruit more people to be a part of this conversation. Thank you, friends and commissioner.
Thanks, Jessica. We really appreciate your voice here and the importance of supporting our family childcare as economic development strategy, small businesses, and we are committed to the full parts of the system. And your voice is really essential in making sure that we're held accountable for that and continue to really think about the needs of the entire system. We have kids and families who are making choices to go to private programs, to use family friend and neighbor care, to have after school programs, to use preschool in the public schools and the private schools. And we see ourselves as responsible for supporting the entire system, including our family child care providers. So really appreciate very much your participation here, Jess, and your leadership in teaching our next generation of teachers as well. Okay, Hannah, and then I think we're going to move on to alternative methodology. I think I'm worried we're going to run out of time to talk about C3, and that was not my strategy. I promise. Okay, Hannah, go ahead.
I'll be brief. So I wanted to talk about very quickly about the workforce and program quality piece that's highlighted in what was being presented. And this is just a thought I wanted to bring forward. As you know, when we're talking about access to higher education or mentorship or or any kind of support for the workforce, oftentimes, if it's individually done or if programs are trying to support their educators or the program in general is trying to do some kind of in-service, pre-service or support system for the programs, it's cost-wise, it's really tasking. So one of the things I'm thinking, or maybe you're already thinking about it, is that whether it's regionally, centrally, or in other forms, if there could be a collaboration around shared services, so that it is not, if consultants or mentors or people who are able to provide this ongoing quality support, either programmatically or for the workforce, if there could be a place where this could be shared so that many programs, more than one program, can actually access it. And then the people that are working, then the cost of their time is shared across the board. So that way, then it kind of, brings the cost down to some extent. So maybe this is something that you're already thinking about, but I just wanted to bring it up so that thinking about some of the, not only the questions and the issues that we have that needs to be addressed within this plan, but also what are some of the ways that we can actually think about that could support this process in a better way, in a most cost effective way. I just wanted to share.
Thanks, Hannah. Yeah, we appreciate that. It is, I don't know if you've met Jose Mendez on our team, new member of the EEC staff focused on business operations and facilities, and definitely a focus on shared services and with some of our support for family child care providers as well. So I think it's a really important part of trying to make businesses having to be viable for programs to stay in business through, again, multiple levers. So really appreciate that. All right, I am going to use the moderator's discretion to move us on to talk about alternative methodology, but I want to thank you all for your feedback in the chat, for engaging in this conversation. We thought that maybe this was going to be not an engaging and a conversation for all of you, and indeed, we got so much good feedback and really are grateful for both the support and the hard questioning and the parts of the system that you're worried we're not paying enough attention to. And that was the purpose of bringing this state plan work to all of you and sharing kind of where we are on our various initiatives. So much gratitude for that. I'm very happy to turn it over to Amy Checkaway and also to Ashley White, who some of you may know from her current role or previous role, and very pleased to have her with us as part of this work. Okay, Amy, take it away.
Thank you, Commissioner. Really happy also to introduce Ashley to those of you who have not already met her, who comes to EEC, came to EEC in late October, feels like a lot longer now, but was in the early care and education space prior to coming to EEC as well, and thrilled to have her as a colleague at the agency. We wanted to just provide a brief update, an overview of work that actually is part of our state plan and really crosses the strategic objectives, all of the strategic objectives of the agency. So maybe we can bring the slides back up if possible. We just have 2 slides. And then I'm going to turn it to Ashley to give an overview and some context, as well as to talk about what's next. And then I'm going to talk a little bit more about the timeline, but really we'll say that we plan to come back to the advisory councils in June to have a more in-depth discussion and talk about this in even more detail. So this is just the beginning. Over to you, Ashley.
Thank you, Amy, and thanks, Commissioner. So I'm going to kick off one of 2 slides here before turning it back to Amy. As folks perhaps on this call may know, EEC has been taking steps towards moving to a cost-informed approach to set reimbursement rates. And as folks probably also know, we partnered with an external organization in 2022 and 2023 to do both a market rate study, which is historically kind of how we've set reimbursement rates, which collects information on prices in the market. But we also had them do a cost study as well to help quantify costs of operating programs under a variety of different scenarios. And so based on both of those analyses, the EEC board approved significant adjustments and rate increases in the fall of last year. And those were really kind of focused on 4, I think, principles. One was recognizing that there are rising operational costs. And so there was a cost of living adjustment within that rate increase. We also wanted to really simplify the rate structure and address some geographic inequities that had been happening. And we also wanted to make progress towards some federal benchmarks. And so because we are required by the federal government to take this, or historically have been required by the federal government to take this kind of market rate approach, there are benchmarks that we have to meet in terms of where we set our reimbursement rates. And so we wanted to make progress towards those benchmarks. And then lastly, we wanted to support some quality investments. And so we integrated quality into the base rates. So that's sort of where we've been. And now we really want to kind of build upon that work. And so in January, we received approval from the Federal Office of Child Care to use this cost-informed alternative methodology to set childcare financial assistance rates as part of our CCDF plan. And so when I say alternative methodology, I mean an alternative to the market rate kind of approach. And so we're trying to move towards this more cost-informed approach of doing things. Why are we doing that? I think there's been growing acknowledgement. I'm sure you've heard it from the agency and elsewhere that setting rates based on kind of prices and the market rate is not the most kind of equitable or effective way to be supporting programs and families. And that kind of cost is sort of using cost as sort of the future. And the federal government has certainly kind of guided and supported states in moving towards that way of setting reimbursement rates. And so as a part of our next state plan, we now have approval to use this kind of cost-informed approach moving forward. However, I think we're still going to be really focused on understanding the market and tuition rates because it's a really essential part of understanding the field and the system. But we do want to kind of really focus on cost going forward. So I'm going to turn it over to Amy now, and she's going to really talk more about kind of the models and the work that's ahead for us.
Yes, thank you, Ashley. If we could go to the next slide, please. So just wanted to quickly talk about concretely, what does this mean? What's the plan? What's the timeline? And what will be happening over the next 3 months, 6 months, 9 months, and beyond? So as Ashley mentioned, just first of all, we actually just posted sort of a notice of intent to, again, procure through a competitive process an external contractor with expertise in financing and cost modeling in the early education care space so that we can move forward in partnership with them to develop and then implement the alternative methodology that was pre-approved by the federal government. So the goal is to really, again, post an RFR for that work, hopefully this month for award in April. And we see the plan ahead as organized into sort of 5 main buckets. First, and intentionally first, is really broad engagement on all of this work with stakeholders. And what this is going to look like is, again, coming back to all of you in June. Ongoing discussions, certainly with the EEC board, and then broader feedback sessions to really get as much input as possible at sort of 3 different stages. First, up front, what's the design and plan? So that's this spring. Then the assumptions and content of the models, which again, as Ashley mentioned, we do have some existing cost models, and the plan is really to update, build on, and refine those models. So that that stage of the engagement will really be later this spring and summer, and then want to engage with the field and again, as many folks as possible on sort of the takeaways and implications in terms of what comes out of these models. So what are we going to do? What does this mean? How can this help improve and support our entire system? And that will happen likely in September and beyond of this calendar year. So the core of the work, as you can see here in the second bullet, and as I just mentioned, is really updating, refining, and expanding our current cost models. So that is going to look like data collection, analysis, again, engagement in partnership with an external organization with expertise in this, which will hopefully really start in earnest around May and continue through the summer, including into September. Then excitedly, also simultaneously building out the models to include revenue. So we know that many programs draw on funding from multiple, both public funding streams to support operations and quality, and really want to better understand sort of the prevalence of the use of different funding streams and capture them in the model, along with other revenue sources such as private scholarships, tuition fees, et cetera. So that's going to be, again, not just thinking about the costs, but also thinking about the revenues, again, with the goal of understanding what it takes to operate a program under current circumstances and also under, again, a future state where there may be higher compensation, other benefits, other professional supports, as we were just talking about. Next, we want to continue to attend to understanding the market, both from a program stability and sustainability perspective, but also from a family affordability perspective. So we intend to continue to track as our tuition rates, again, across the state, and partner with, again, an external organization who can then report back to us on findings of what's happening in the market at different points in time over the next year. And then finally, and maybe the boring part, but also another important piece is just ongoing reporting. So recognizing that this work is iterative, and in terms of public reporting, if our timeline, which is ambitious, but again, this work is really important, so we want to continue to move as quickly as we can. So if the timeline progresses as planned, I think there's going to be ongoing consideration of the learnings and implications of this work and what it means for fiscal year 26 and beyond. And certainly there will be more formal detailed reporting and presentations maybe as soon as this fall, and then continuing on into the future. So just really wanted to provide a quick update. Again, we can come back and talk about a lot of the details of what we mean, but hopefully, I think the word, again, alternative methodology, sounds kind of vague and maybe a little confusing, but just wanted to keep everybody apprised of the direction we're going in, again, to really pay close attention to and understand in an even more comprehensive way, sort of what it takes to, again, move forward to improve equitable access to care and really support program stability and quality, both from a cost and revenue perspective.
Great. Thanks, Amy and Ashley. And the alternative methodology, cost work, to understand the cost of care, both of those pieces of research go on to try and inform everything we're doing, how we're doing rates, how we're thinking about childcare financial assistance. So we are up on time, which again, I apologize. We will definitely get the slides out to everyone. So this is what we're going to do. I have asked Mark Riley to join us from the Executive Office of Education. There's a lot going on in the early education and care field and a lot on everyone's mind today, but I didn't want to lose this group for a whole nother quarter without sharing a little bit of what we're working on in terms of the whole government approach to childcare. It's part of taking that bigger macro look at how the state's infrastructure supports access and affordability to childcare. So I'd ask Mark to come and share a little bit where we are on that group and what you all might expect to see from the administration. And then for those of you who are interested in staying on to talk about C3, both, you know, sort of an update and what's happening, the EEC team will be able to stay for at least 15 more minutes. So I know probably a lot of people have a hard stop at 2:30, and I apologize for us going over time. We'll try and do a better job of getting things out on time and staying on time. But Mark, let me turn it to you. And then for those of you who can stay after 2:30 and want to talk a little bit more about C3, the EEC team will be here for that.
Thank you so much, Commissioner. Appreciate it. Hello, everyone. I'm Mark Riley. I'm the Undersecretary and Chief Operating Officer at EOE. And appreciate the invitation to chat with you all. I'll give you a little update. In case you missed it in the course of all of the governor's robust budget proposals to support early childhood back in January, there's one other piece of work that she announced, and that is she adopted an executive order intending to bring the entire cabinet secretary in and behind Commissioner Kershaw, her team, and Secretary Tutwiler here at EOE to focus on early childhood. And the real purpose of that executive order is recognizing how much of the work that all of you spend all of your time and energy focused on actually touches so many other parts of our society, and their particular worlds, right? And so so to give you just a little bit of a flavor for it, and I'll be sure to drop the executive order right into the chat for anybody who didn't hasn't had a chance to look at it. But what you'll see there is that she has established, first of all, 3 co-chairs. So it's being co-chaired by Secretary Tutwiler here at Education, as well as our Labor and Workforce Development Secretary, Lauren Jones, and Yvonne Howe, who is our Secretary of Economic Development. And they are the co-chairs. Obviously, Commissioner Kershaw will be right with us every step of the way, too, in developing and supporting, all of this work. And we will have folks from each of the other cabinets, cabinet secretariats participating with us as well. So we've started to actually meet as co-chairs and had an amazing meeting this week. In the energy and range of ideas that, in particular, obviously we have ideas because we've been in this all the time, right? But specifically the ideas that Secretary Jones is already raising, the ideas that Secretary Howe is already raising, and their level of interest in really trying to support and help this sector was palpable in the meeting. I'm really excited about it. In terms of what you all should anticipate, we're planning to embark on about a year's worth of work. And first, and one of the steps along the way is obviously organizing our task force more broadly. We're doing those steps now. But you all should anticipate several months of opportunities where we're going to be engaging out with all of you and the community to solicit more input, ideas, suggestions about other areas we should be considering and thinking about, which in turn, we'll all be building this toward a set of recommendations and steps that we think are collectively are sort of the best steps forward in ways in which all of the aspects of the system can be improved. And our goal is to develop and finalize all of those recommendations by November, December at the latest, so that they can inform the next round of the governor's budget proposals and potential changes, maybe some pilots that we may be able to start implementing to advance the sector even more so. Okay, I have so much more to say and do, but I know we're short on time now. So I would just encourage folks to just stay tuned. We'll have information going out about opportunities to engage and for you to be involved in this work as we go, and just keep your ear to the ground, and we look forward to working with you.
It's very efficient. Thank you so much, Mark. And, the reason I thought it was so important for us to talk about this today is because it does take it out of just sort of EC, our programs, our line items, and thinks about all of the broader resources that state government and our employer community and philanthropy and our workforce system have to bring to support early education and care. And we're going to need all of them to address many things we talked about. So thank you, everyone. For those of you who have to drop off right now, we will say goodbye and we will see you next quarter. And for those of you who want to stay on to talk a little bit about sort of current status updates on Commonwealth Cares for Children, then we're here for that. So we'll just give a couple minutes for folks to drop if they're going to.
Commissioner, do you want to keep recording this part of the conversation?
Yeah, I think we'll keep recording it if it's okay with everybody. We are going to have some more drop-in sessions. So this will probably be our first informal one, Eugenia.
Can I make a suggestion?
Mm-hmm.
I think you should stop and make it another one because it'll make the file super long. It'll make it hard for whoever uploads it.
Could you possibly just send the executive order to all of us? Because you have our emails. Would that be possible?
We'd be happy to.
Yeah, we can do
That'd
that.
be great. Thanks. And if I can be of any help with public schools, I'm happy to, as I'm
Great,
sure
thanks.
Roy would be too.
Thanks, Ellen.
Thank you.
All right, so what we had been intending to do is give you a quick update on where we are on C3, and we'll do more of this at the board meeting, talking a little bit about the impact and the growth in the program. But I think what I'm going to do is fast forward to just a verbal update to sort of what's happening right now in 24, and make sure we give a little bit of time for you guys to chat and give us some thoughts about feedback. So as most of you have heard, probably some of you in person, probably some of you via email today, for the last several months, we've been tracking amazing program growth for C3. And the good news is it's working exactly as we anticipated it would. Bringing in new programs, helping people hire new educators, open new classrooms, serve additional children. And I also want to say that even though this is a really difficult moment and we have some programs who are going to be really struggling at the end of the year, we are fortunate in Massachusetts that we are not facing the same cliff that other states are facing with the ending of the federal funds. We've supported C3 all through last year. We are supporting it this year, and the governor has proposed supporting it at $475 million next year. We have known we were at an inflection point around changes to this program as it transitions again from that COVID stabilization to more operations. This is not how we would have wanted to change the program, but the agency is responsible for living within its appropriated funds. And we are committed to making changes that enable us to think about how to sustain this program going forward and make sure that we are creating predictability for all of you. So many of you have already heard that we are looking at a shortfall in FY24, which is necessitating us to make some program adjustments to grant payments for May and June of this year. We have grouped programs into 4 categories around those program adjustments. And the first category is programs that are serving at least 33% of kids receiving child care financial assistance. And this also includes our Head Start and Early Head Start programs. There will be no program changes to their payments for May and June. The second group is programs that are serving between one child, and up to 32%, up to 33% of their of their capacity is child care financial assistance, children receiving child care financial assistance. For just May and June of this year, they will be receiving about a 45% reduction in their monthly payments. There is a third group that are programs that have child care voucher contracts but are not currently serving any children. This is a tiny percent, about 2% of programs. They will be receiving about a 70% reduction in their monthly payments just for May and June of this year. And then there's a fourth group of programs who are not serving any children receiving child care financial assistance. They are also not operating in a community that has a high social vulnerability index. And those programs are going to be receiving about a 75% reduction in their monthly payments, again, just for May and June. We are continuing to advocate for the continuation of this program in FY25, but these changes do foreshadow some of the discussions we've been having with all of you, many of our legislative colleagues, about the kinds of program adjustments we might look at going forward. So I want to highlight a couple things that we're doing in 24 that we are very much committed to thinking about in 25. One is universality. Everyone is going to continue to be funded in 24. We think this has been an essential program support for everyone across the system. And as we talked about earlier, every program type and to support family choice and our market in general. So you see through 24 and as we are looking into 25, supporting universal eligibility for participation in C3. We also think the formula can be adjusted to better support our program serving low and moderate income families. And you see that in sort of how we're tiering the approach to this. One of the other things we're going to need to consider for 25 is probably establishing some consistent monthly amounts. Right now, you know, the way the program works is that each month programs apply, and based on the number of children and staff that they're serving or their capacity, their grant payment might change. And the good news is, in a time of growth, when we were supporting the field to come back from the pandemic and expand and grow, that was a really essential strategy for us to be able to continue to support programs, to add staff, add new kids, add new classrooms, open new programs. And now we're kind of needing to make sure that we're operating within an appropriated level. And so next year, we're thinking that there may also be an opportunity for consistent monthly amounts that will help us budget and will bring greater consistency and stability to programs in the field. So let me stop there, ask members of the team, Jocelyn, Chris, Eugenia, what are some of the key points that I didn't hit on that you want to make sure we talk about today?
I think you covered all the really important things. I will say too, for this team, we did prepare some slides for that. So we will make those public post the meeting, just like the other slides that we walked through that show those principles that the commissioner was talking about and how we think about C3, so that you can see that, as well as the participation in C3 and how it's grown over time. Because I know some of you will want to see that and what that looks like. We will go in more depth in the board meeting next Wednesday. So we hope that you tune into that because we will be sharing a lot of important information that we've learned over time. And I just want to share some of what Commissioner Kershaw had said about, like, we really appreciate the partnership that all of you have brought and the thoughtfulness that all of you brought. I've called a lot of people and to share this news, and overwhelmed by the kindness that folks have shared, the thoughtfulness in their questions, and their thinking as they think about talking to their teams about this. So just want to share my thanks to all of you as well.
We open it up for any questions or comments. Didn't want to jump to the slides, but there's some good data that we've been tracking. One of the things that C3 has enabled us to do is have insight and understanding of the entire system, the impact not just of C3, but sort of where the system is. So that's a really important piece of kind of our key takeaways of looking at the data as well.
Commissioner, I just wanted to say that, we've gotten a few emails, so we are going to do a quick check-in about it on Monday on the 9:30 call. And then you are scheduled to come on the 9:30 call on Thursday. And we'll have folks watch the board meeting, and we will have an updates from the field the next week, which is the 4th anniversary of the 9:30 call, the week of March 18th. But I think, any way that we can help, get information out, get feedback, we're happy to play that role, both on the call and beyond. So
absolutely. And, we look forward to using the 9:30 call, our advisory boards, and open lines of communication as we continue down. These efforts, as very difficult as they are, and I just want to thank the team who's done this work. We thought a lot about different ways of approaching this to stay within our budget, whether it was an across the board cut or letting the program run out in some way. But I think the team felt really strongly that we begin to apply some of those principles I discussed. So I want to thank the team for their hard and thoughtful work on this. Not easy work, but important and thoughtful work.
And Commissioner, I've said this to you, but also I think just, as we've been using opportunities around the state budget process to talk about kind of what belongs where, like how the line items fund things, that kind of just clinical explanation of how line item language works and how you have to spend money based on the budget that the governor signs and the legislature passed. Because I think, there's been the 65 million in the rates, which was in one line item. This is in another line item. So just, I think any kind of explanation of how we got here and kind of what the opportunities are going forward. That's another important piece to just, pull out and be really kind of explanatory, because sometimes the process is so confusing and it can just be hard to understand what's happening.
Absolutely. I mean, we had it with the caseload. We have been in a time of growth and expansion like whether it's serving more families in childcare financial assistance, really trying to build back, stabilize and heal from the pandemic in terms of capacity. And we're reaching a point of greater operational stability. So like any household budget, you have to live within your means. And the means we've been given for C3 are 475 million. So we are committed to spending every penny of that, but we are not permitted to go over that. So be happy to talk more about that on the 9:30 call. More good times, right? Okay, Jessica, go ahead.
Thank you, Commissioner. I just had a question. So are these meetings with all of these executive, is this a public meeting or is this like, how do we learn more? And then for you, Commissioner, that you are part of the meeting, I guess, like, what was your biggest takeaway from all of the high level conversations about working together, new partnerships, and, you know, highlighting and uplifting childcare at the center of the conversation? So I guess
And
two questions.
Jess, you
How do I
asked me
keep
about
following?
this
Yeah.
one or the opportunity agenda last week?
No, for this one, for the specific the executive order.
Okay, yeah. So let me say to learn more, I mean, the meetings will absolutely be public. We'll make sure everyone's aware of those. We'll be talking about it at our board meeting and make sure that there'll be opportunities for public engagement, as Mark said. And so I don't know if there's going to be like a website for the task force, but we're probably working out all those details now. It hasn't had its first meeting yet, but I wanted everyone to know about it because I think it is pretty exciting, even on the tail end. Some really hard news today.
Thank you.
Thanks, Jess. Okay, last comments or thoughts before we close? I think my takeaway, Jess, to your question from this and really from the last week and is exactly where Eugenia started, which is that like we've had unprecedented growth and investments in early education over the last years. Times are a little bit tough now in terms of fiscal. We are hearing from the governor and from both House and Senate still an incredible commitment to early education care. The Senate was up, Senate President and her leadership team up in Malden today filing a bill on early education. And so I feel like our resources and the work of the field are continuing to be recognized even difficult times. And I'm just incredibly grateful for like the grace and partnership of members of the field, the 9:30 call, all the participants there, also all of you who showed up today to engage in this conversation and care so much about the priorities of the agency and partnered with us on getting better and being the best leader we can be for the field as much as possible in partnership with you. So I want to thank you for that. It's holding me up today. All right. Thank you again. And we'll see you all very soon.
Happy Thursday.
Thank you.